Why is TB meningitis so deadly if not treated quickly? Imagine a tiny bacteria that can turn a life-threatening condition into a rapid medical emergency. That's what happens with tuberculous meningitis, a serious form of tuberculosis, where the bacteria infect the membranes covering the brain and spinal cord. When Mycobacterium tuberculosis invades these protective layers, it triggers a fierce inflammatory response. This inflammation causes swelling and increases pressure inside the skull, which can cut off blood flow to the brain and damage vital tissues. The swelling also interferes with the flow of cerebrospinal fluid, leading to a buildup of fluid called hydrocephalus, which further raises pressure and risks brain injury. One of the biggest challenges with tuberculous meningitis is that its early symptoms are often vague. Headaches, fever, irritability, and neck stiffness can be mistaken for less serious illnesses. Because of this, diagnosis can be delayed, giving the bacteria more time to multiply and worsen the inflammation. The longer the infection goes untreated, the more damage it causes to the brain, increasing the risk of death and permanent neurological problems. Even when treatment is started, the outlook can still be grim. Despite taking antibiotics for 9 to 12 months, studies show that up to 2/3 of patients with TB meningitis may still face death. Those who survive often suffer lasting effects like cognitive difficulties, paralysis, or seizures because the infection and inflammation have already caused irreversible damage to brain tissue. Certain groups are more vulnerable to rapid disease progression. Young children, older adults, and people with weakened immune systems, such as those with HIV, are at higher risk of severe illness and death. Their bodies struggle to contain the bacteria and control the inflammation, making the disease more aggressive. Another obstacle is the blood-brain barrier, a natural defense that protects the brain from harmful substances. While it helps keep infections out, it also makes it harder for antibiotics to reach the bacteria once they cross into the brain and meninges. This means treatment must be prolonged and carefully managed to ensure enough medication gets to the infection site. If TB meningitis is not treated promptly, complications can develop quickly. These include strokes caused by blocked blood vessels, nerve damage leading to cranial nerve palsies, seizures, and even coma. All of these complications contribute to the high risk of death and long-term disability. In essence, TB meningitis is deadly if not treated quickly because the infection causes intense inflammation that damages the brain's protective layers. This leads to increased pressure, impaired brain function, and life-threatening complications. Early diagnosis and aggressive, prolonged treatment are crucial to saving lives and preventing permanent harm. If you or someone you know shows symptoms suggestive of meningitis, seeking immediate medical care is essential. Always consult healthcare professionals for personalized advice and treatment options.